placement okay? Can't see myself. Okay, great. The good kind of gossip. You know.
We're good? You sure? We can stop gossiping now. Good afternoon, everyone. Thanks for joining us live on Facebook. This is our weekly town hall. Thanks for being here. Want to jump right into some data points so you know where we are. But I will say that the numbers we want to start moving in the right direction are moving in the right direction. We just want to be very sensitive over the course of the next couple of weeks. Clearly, there are variants of the COVID-19 virus in and around the community. That's likely going to result and has certainly resulted in, certainly this part of the state, a rate of transmission that, we just is stubborn. We want to be sensitive to that. We also know that spring break, traveling, and certainly Passover, Easter holidays will likely have led to some transmission of the virus. So we hope that cases don't rise significantly. And of course, we don't want anyone to be sick or need hospitalization. So let's jump right in. Currently, the county's health department is monitoring 1,320 active cases, 1,320 active cases. Now that's down from 1,405 last week. So again, that's pointing in the right direction. Hospitalizations are up slightly, 67 hospitalizations, up from 59 last week. And sadly, we saw one additional death and individual succumb to the virus. Now, the 7-day rolling average positivity rate is 4.53%. 4.53%. Now, that's as of the 5th of April. That number has, again, been stubborn. We've gotten, and we were near 6% a few weeks ago, but we were down below 3% only weeks before that. So we want to monitor that, be sensitive to it. I will tell you what Dr. Wythian and the public health officials certainly believe, and I said it just a moment ago. There is the expectation that there are variants in and around our community. The virus mutates. It takes on sort of a different, persona, if you will. And we know that those variants are a bit more transmissive, and therefore we absolutely believe that there are cases in and around the community that are a result of that. Now, also, again, fatigue with following some of the restrictions. The relief of some of those restrictions is certainly to be considered. Travel, holiday interaction, social interaction, all of that. And again, nothing that anyone's being chastised for, but the reality is that kind of behavior, that kind of activity is going to lead to some transmission. And again, that 4.5% positivity rate is like it's stubbornly stuck in that area, and we just want to be sensitive to that and monitor that. And of course, we don't want anyone to have to seek hospitalization or have a severe onset of the virus. So we'll monitor that. We want you to keep vigilant in following those basic mitigation steps we've talked about time and time again: physical distancing, wearing a mask, washing your hands, being sensitive to your own health and your own health conditions, and trying to be respectful of the health of others is all very, very important. So we do want to talk a little bit about vaccine distribution and where we are with vaccines. We'll tell you that we are seeing an increased allotment and distribution. So let's talk specifically about the data points for vaccine and where we are with vaccinations here in the county. So first, I want to talk a little bit about Dutchess residents receiving their first dose. So the dashboard is always 1 day behind. It's always yesterday's information because some of the data that comes from the state is a 24-hour lag, some is not. I will tell you vaccinations is not a lag, but we hold firm and we'll update everything. And so you'll see that updated information tomorrow. So I want to actually give you today's up-to-date vaccination data. So far, 103,643 Dutchess County residents have received at least their first dose of a vaccine. That represents 35.3% of Dutchess County residents, and that's been accelerating over the last couple of weeks, and that's very positive, very promising. With the opening of state vaccine sites in our neighboring counties, We also have received increased dose allotment. Very grateful for that. The state is providing the county additional doses each week, significantly so, and we are making good progress. We're now at 35.3% of our total population receiving their first dose. 59,503 residents have been fully vaccinated, completed their whole series, whether it's a single Johnson & Johnson dose or the 2 doses of Moderna or Pfizer. That represents approximately 21% of our population now fully vaccinated. And do we have vaccine numbers in the surrounding, the percentages around? Let's look a little bit of those. No, we don't. It's fine. But really very promising and very happy about where we're moving. So let's talk a little bit then about the vaccine allocation. This week, Dutchess County locations are receiving 6,000 total doses. You can see the breakdown here, 6,000 total doses, 3,600 doses administered by the Department of Behavioral and Community Health. So our health department is going to be administering 3,600 doses this week. 1,400 doses being administered by hospitals and health clinics in Dutchess County. An additional 800 doses administered by doctors' offices throughout the county, and an additional 200 doses administered by pharmacies. Now, these are not the only doses being administered in Dutchess. These are the ones this is what's allocated this week by the state to these locations. So I do want to say this. What we've created in Dutchess County is a very strong network in partnership with our pharmacies, with our doctors' offices, with our health clinics, and with others. So while the county health department's administering 3,600, there is nearly an equal amount being administered by other partners throughout the county, and we'll talk about that next. So first, the county's allocation, 3,600 doses. That is both Moderna and Johnson & Johnson doses. We are administering 1,720 first doses at our fixed pods. So at the JCPenney's location in Poughkeepsie and at the CVS location in Dover, we'll be administering 1,720 first dose Moderna shots at those fixed pods. Now, additionally, as I said, 800 doses will be administered at our community pop-ups. In fact, today, 400 doses administered at the FDR High School in the town of Hyde Park. This is a pop-up clinic that we host, and we're hosting in Hyde Park. An additional 800 doses will be next week in LaGrange at an Arlington school for another pop-up. And then, as I said, 1,180 doses being administered by our partners at additional pop-ups. Now, that might be a homebound senior facility or something of that nature. That's the total of our distribution this week through the health department. Very, very positive. So I do want to, again, say that today we conducted 400, in fact, we still are, 400 vaccines at the FDR High School in Hyde Park. I want to thank Supervisor Aileen Rohr and the town of Hyde Park for assisting us in getting individuals scheduled for that pop-up. Many of you received emails and communication from us, whether it be for the fixed pods or the pop-up in Hyde Park. We will next be at the Arlington School District next week. That'll be Wednesday. The Arlington School District will administer another 400 doses at a pop-up clinic. We are then scheduled for future clinics at Millerton, the village of Millerton, in the city of Poughkeepsie, in the village of Pauling, and in the town of Unionvale. And so these pop-ups every week, every Wednesday, we'll be hosting one. And then we have additional pop-ups, smaller activities in sort of senior housing complexes or what have you throughout the week. So really very happy about about the progress we are now making, and we are seeing an increase in dose allotment. So this week, though, we'll administer over 5,000 first and second doses throughout the county. So over 5,000 first and second doses just within Dutchess County. And then, of course, those additional locations outside the county will have access, and folks will be administering vaccines there. I want to thank Dick Thurston, who messaged in. Thanks, Supervisor. We've had a great relationship with our towns and villages, and I really want to say this. It's been a long 14 months, but supervisors, mayors, local elected officials have been working together like never before. Republican and Democrat, they see the focus, they know the need. Dick Thurston among them. Truly tremendous collaborative effort to serve the people of Dutchess County, and he was asking what's next. What's next is more outreach. So at some point, supply is going to reach demand, and what that means, right, is that we're going to have to be more innovative in getting doses to locations. So you're going to see more of our homebound delivery, where we're doing vaccines in homes. We're doing that now with the Office for the Aging. Caremount and other providers are assisting us in getting into homes. I think the last 2 weeks we conducted about 100. We're going to do, obviously, as many as we can every week. A little more logistically complicated because we need to be sensitive to every individual, and we have to be sure the right resources are there in a home. But we're going to do more homebound outreach. We're going to do more pop-up clinics, and hopefully working with some partners, we'll be able to create some new vaccine points in and around Dutchess County with some regularity. So you should look for that soon. We've been having conversations with new partners, and the state has been good enough to provide increased access to allotments. So you're going to see some advancement over the next couple of weeks that will be really, really helpful to us, and we'll get to people who may not have direct access to the internet, may not necessarily have even any knowledge that what's available to them. So there's going to be more of that kind of concerted effort. Maureen is asking, has Cuomo made any decisions about graduations? The short answer is no. The state has not made any new determination. However, we expect new guidance from the state in the next week or so. So hopefully within the next week or so, we'll see some additional guidance. I absolutely agree. In particular for graduations, parents and families need to plan. I will tell you, my observation certainly is if it's an outdoor graduation, it is entirely safe to structure a graduation outdoors with students in person. We just have to be sensitive, obviously, to grouping and gathering. But we've seen in many other activities, in the states allowing casinos to be open and sporting events to occur, there is no reason that a school should not be able to organize, and again, in a safe way, an in-person graduation. And I, for one, absolutely believe that high school students should be able to cross that threshold and receive their diploma. There will be guidance that has to come out, but we think that there's a way to do that, and we've certainly communicated that to the state. There's a way to safely accommodate that, in particular, in an outdoor graduation. So we're very hopeful and will work toward that. Melanie, what kind of things are we doing to stop the spread? As I said, we're encouraging people to follow the basic guidance and mitigation steps. These are the things that we ought to do. So we ought to keep wearing our masks. We ought to keep that physical distancing. We have to be sensitive to our own health conditions, right? If you're not feeling well, and also obviously wash and stay clean. But we're doing that in a number of ways. We continue to communicate to municipalities, church and faith organizations. We're doing that with not-for-profits and other congregate care settings. We're also on top of it, right? So our response with the health department has been really very promising and very effective these last 14 months. So we're interacting regularly with healthcare providers and nursing homes and other organizations. So we're just going to continue to send that message. It's one that's important, and it is one that it is a message that we really have to keep with. And I think just being sensitive to your own health and being sensitive to the health and conditions of others is critically important and just the right thing to do. Why is New York one of the top 5 seeing surges in cases? Why is New York seeing a surge in cases? I can't dissect that for you. What I can tell you is this: density of population and mass transit has something to do with it, certainly. So the ability to be on top in very small, confined space, right? New York City is a very densely populated space in a small geographic area. The outward mobility through mass transit always was a transmission concern, and we saw that early on. We also don't want to say again that we absolutely know that there are variants in and around the community that are more easily transmitted. I know why the Commissioner of Health has talked about this on these town hall meetings before, but just because we aren't testing every case, and I say there's the laboratories aren't identifying every variant in every case, there is little question that the variant is in and around the community, and that variant is likely more more easily transmitted. We know it is, and that is likely has something to do with case transmission, and certainly in the state of New York, in particular the city of New York. And if you look at New York State, I mean, very candidly, from I'd say south of Columbia County, so Dutchess County to the tip of Long Island, you do see a different dynamic than you see north of us. Now that likely has something to do with density population and that sort of direct connectivity. And so we're aware of that. We're watching that. And we're absolutely going to continue to take those steps to be safe. Jason Verzi, JCPenney's was a great experience. The staff was excellent and friendly, but you couldn't find a suit. Ha ha, Jason. You've run. You know, it's funny. I joke that we're going to have vaccines here, women's clothing here, handbags over there, men's sporting goods, sporting activewear. But thank you, Jason. I hope you had a good experience. I was just at our clinic today in Hyde Park. I will tell you, they run seamlessly, and the staff at the health department and emergency response, along with the volunteers to the Medical Reserve Corps, they do a tremendous job. So I'm glad that you had a great experience, and next time we'll take your measurements and send you a suit. Donna, heard vaccines are only good for 6 months and you can still get COVID. How does this work? Okay, so I'm going to tell you what we know from the science and the studies, and what Dr. Wythian, who is an infectious disease doctor, he's our commissioner of health, has had to say. First of all, that we have been saying, they have been saying that once you're fully vaccinated, yes, that the assumption is for now, because there is no science, right? We haven't had the vaccine in place to study how long it is effective. They're saying actually to monitor 90 days and beyond from the completion of the vaccine. So you finish your vaccine, you become in essence totally vaccinated and covered, I think 14 days after the second dose, if it's a 2-dose shot. Or 14 days after your first dose, you become vaccinated, in quotes. And then from that day forward, they say basically another 90 days. Some of that, as Dr. Wythian has said, is simply to say to people, listen, we have to go the next 90 days, so we can go to the next 90 days. So until, it's like any other study. And we are monitoring its effectiveness. If it's effective for 90 days, they'll determine if it's effective for another 90 days. So currently, there's not an expectation that the vaccine isn't effective well beyond 90 days. What Dr. Wythian has said is, quite frankly, it is expected that this is a year-long vaccine with, like a flu shot, you would choose to get that dose every year at your choice. But again, at some point, we're building up our own immunity or level of immunity to it. So the more vulnerable would more likely want to have a vaccine, and those who are less vulnerable might choose not to. So again, just to be clear, this is not a hard and fast at 6 months you're done. You have to get it. Again, it's simply to say that we only know what we know now about the effectiveness of the vaccine. The assumption is that it would last a full year, but they're really looking at it at those 90-day increments. After the 14 days of having a vaccine and you're vaccinated, they're going to watch. And after 90 days, if it's still effective, well, then it's still effective. So they're going to tell us that it's good for another 90 days. But Dr. Wythian has said the expectation is that this is a year-long vaccine with the theory that it could likely become an annualized vaccine that you would choose whether or not you wish to take. So the other is, can you still get COVID? Just like you take a flu shot, you could still get the flu. There's always the chance that there's a percentage chance that you could still get sick after taking a vaccine. None of them are absolutely perfect, although I will say the studies on the Moderna shots among younger people, the Pfizer shots among younger people are proving to be, I think, like 100% effective. So, which is what they're saying. So again, that's just the reality of any vaccine. I mean, we take a vaccine, you could still get a disease that it's meant to protect against. The expectation is the vaccine helps us to build up our own immunity toward it, and ultimately we're able to combat the disease on our own. And so, just as again, the likelihood is you might be asked to choose to take a vaccine, the flu vaccine every year. You might be asked to do the same here. Wappinger's school district said at last board meetings that staff is still waiting to be vaccinated. Can they be prioritized? Maureen, they already were prioritized. If a teacher needs a vaccine, they are to notify their school superintendent. And we were aware of this conversation at the school board. We talked to the school board president, Lumia, right? Is he the school board president? Oh, I hope he is. What's that? It's who? No, that's the superintendent. The school board president, I think, Dwight Bonk is the superintendent. He's a very nice guy. Thanks, Dwight. We talked to the school board president. He said actually he has no problems with us. He actually knows that they've gotten all the doses they've asked for. We have for months have coordinated with the school districts. Every school district was given priority. Every school teacher and staff person was told if they are willing and they consent to being vaccinated to give their name to the school superintendent, and they were prioritized. As of today, there is no school district that has a list of willing and consenting staff members who are waiting for a vaccine from Dutchess County. So if you are a school teacher or you work for a school district and you feel as if you have not you haven't gotten your vaccine but you want one, you should reach out to your school superintendent. But to Maureen, the Wappinger School District, like all the others, confirmed with us when we talked to them after we saw a letter go out to the state that we've met their goal. There is not a waiting list. So if there is somebody waiting, they should be reaching out to the school superintendent. That's what we've done every week for now 17 weeks. We prioritize those essential workers based on the state expectation. New York State expects us to do that. Mark is asking any changes to local policies for spectators at outdoor high school sporting events. The short answer is that some of this is led by the state. Our high school, right, our sporting activity guidance for spectators currently, we kind of give them some flexibility, but most districts and most leagues are doing 2 spectators per home player, no spectators allowed for visiting teams. That is not our expectation. So what we're saying, just so you're aware, the county has basically said to try to mirror the 2 spectators per player, but that is not limited to one team or another. And for an outdoor activity, that shouldn't be a concern at all. And so if you're part of a league that wants some of that clarification, you can reach back to us. We'll try to get you the answer. But there is no local prohibition on at least that. So 2 spectators per player is the guidance we've given, but it's still within the league's right to come up with rules on their own. It's their decision. New York State has said we leave it to the sporting events, and if the health department says it's okay, then you can do it. So we've said to the health to athletic leagues and to school districts, two spectators per player is the norm. It's sort of the acceptable number, in particular for indoor. But if you want a different set of expectations, you want to change those rules, all you have to do is ask us, and we'll give you that guidance. So there is no county health department restriction on that. And some leagues have decided to do their own thing, right? They for whatever reason, are limiting it further. I would say to you, as the parent of a child who plays and as a coach for a soccer team, I think it is absolutely fair to say the standard for the home team is the same standard for the away team. And there are ways to accommodate that. We are not seeing mass transmission of the disease in the virus when there are sort of restrictions, right? You're on the field, you're at the event, you're going to wear your mask, you're going to monitor your health. If you're not feeling well, you shouldn't go out to the game that night. And we just try to keep those restrictions in place. There is no local restrictions on that. So just to be aware. If you have a question and you've already figured it out, write it in that comment section below the live stream, and we'll get to as many as we can. I want to remind you, if you want to be considered for a vaccination at a Dutchess County Health Department location, you need to visit dutchessny.gov. I want to be clear about how we do this. For the county health department clinics, now these are the only ones are the pop-ups. The only ones we run are the pop-ups that I talked about in those 2 locations: the former JCPenney's in Poughkeepsie, the former CVS in Dover. Those locations and our pop-up clinics, we pull from this list. You're on this vaccine info list, and we pull from them, and we're going through thousands a week. So if you want to be considered for a vaccine, we need you to go to dutchessny.gov/vaccine info form. If you do that, you'll fill in your information, and as vaccine and appointments become available, we will contact you. If you don't have internet access, or you can't navigate through that system, or you want to make sure somebody who has limited access needs help, there are a couple options. You can call or visit any library in Dutchess County. Very grateful to all of our libraries individually. I've said this at every week that we've talked about it. Especially, I'm personally very grateful to Miss Amy and the Red Hook Library. Do a tremendous job. My kids are all involved in different activities. My daughter's involved in their All Abilities program. Made some really good brownies yesterday. Zoom Zoom brownies, online cooking, and that was great. But very, very grateful to the Mid-Hudson Library Association. So any library in Dutchess County, you can call or visit. They're going to put your information in that form. Or you can call our COVID hotline at 845-486-3555. That's 845-486-3555. You're going to press 1. When you press 1, you're going to hear the weekly update. That weekly update is going to tell you there's 1,000 doses here, there's 500 doses there, there's 200 doses here. When you're done listening to that, at any point, press 2. So you're going to press 1 to listen to the message, press 2. You'll be transferred to an Office for the Aging staff member or volunteer who will get your information into our vaccine info form. And so that will get you on our list. And as we have scheduling availability, we will be contacting you. Now, I also want to say this. From time to time, we do an open link. Now, several of you have complained about that, so I want to explain it. There are occasions where, in the middle of a day, the state of New York will say, we've got 50 doses at a pharmacy that we need to get used. Can you use them? And we will say yes. We have never said no. Dutchess County never says, no, give it to somebody else. We say yes. We'll take those 50 doses. We may need to use them immediately. Or throughout the day, people have scheduled to be at one of our pods, but they also scheduled to be somewhere else. And they got their dose somewhere else, and they realized, oh, shoot, I've got my scheduled appointment. I wasn't going to say anything else. I got my scheduled appointment, and they'll cancel their appointment with Dutchess County, and all of a sudden we get an availability. Or throughout any given day, we may just have more vaccine available. When we have a tight window, meaning a short period of time that we need to get appointments scheduled, we could do this one of two ways. We could randomly call people through the list and hope you're there and are willing to get out. That doesn't make sense. We post them or we'll email them out. So on occasion, we'll just say to you, we've got 30 or 50 or 100 availability tomorrow at noon, and then you sign up. That's not the norm, but that is one of the ways we do this. We'll push it out. We'll email it out to everybody on the list and say sign up. We may also put it on our Facebook page or social media if we need to get them filled quickly. And so, again, the primary way we give out appointments is through our contact list, through the wait list. We call you, and most of the time, I can tell you, this office, they're gonna fill in your information. They're calling you to schedule. The Office for the Aging is calling seniors to make sure that they didn't get missed. So we're going through that list constantly. But on occasion, we get availability of doses, and we want to put them to work quickly, or we have to make sure that appointments get filled quickly. We will push that out in an email to you, and yes, it's much less equitable, but it is the quickest way to get to you some information. You are going to see that transition over time, because we're getting to a point now where we're getting through the list, and there are folks on the list. Some, I know this, haven't gotten an appointment at all. You've been on it months. That's the problem with being random. But then there are many who are on the list and haven't opted out or are scheduled someplace else, and they decline our appointment. So we are going to be at a point soon where we're going to start posting them on social media. We're going to start putting out the links so that people have access to it. We'll keep you posted on that. It'll be a transition over the next couple of weeks. But the goal here is to get to as many people as possible using our wait list principally and primarily, and then using other means to get you that information. But that's sometimes how it happens, and you should be aware of that. And again, if you're a senior citizen or somebody who cares for a senior citizen, that phone number, that 486-3555, please tell us, in particular if you're homebound, please call us and let us know at this number so that we can schedule you for an appointment, and we will make sure that happens. Excuse me. Okay. Some additional information. We also want to remind you how to participate in our public transit survey. That's online. We want you to be able to visit dutchessny.gov/public transit. You can fill out our survey, and we're trying to pull together some additional information and some data to help us improve public transit. But one way we're going to improve public transit, and we'll have more formal information, is but beginning Saturday, April the 10th, so this Saturday, anyone who has an appointment for one of our fixed COVID vaccine clinics can ride the Dutchess County Transit System for free. So beginning Saturday, April the 10th, if you have a scheduled appointment, you'll be asked to show proof of that scheduled appointment, but you'll be able to take the bus to those pod locations at no charge to you. And we'll have some more information for you later this week. And we'll be using all of our public transit options to make it as accommodating as possible to get you to the vaccine location. So keep an eye out for that additional information. But beginning Saturday, April 10th, we're going to be providing free public transit to anyone who's got a vaccine scheduled at one of our established clinics. So look for that information in the next couple of days. And we'll continue to expand that availability. Additionally, I want to remind you that tonight we're hosting, the health department is hosting, it's not tonight. Well, it says tonight. The card says it's tomorrow. This says it's tonight. I know, I'm taking advantage of the fact that I have the microphone and you don't. Thursday, April the 8th. Thursday, April the 8th, 5:30 to 7:30. We're hosting another public forum. This on chemical dependency and substance use services. This is to help us continue to expand and enhance the way in which we provide those services. And Dutchess has a broad array of chemical dependency and substance use disorder services. So whether it's accessing Helpline 24 hours, 7 days a week, or the Stabilization Center, along with other resources that we provide, Narcan training, substance use disorder assistance through some of our programming, we want to hear from you. So please do participate if you can. Thursday, April the 8th, 5:30 to 7:30 p.m. Go to dutchessny.gov/forum comments and participate in that. Number of questions regarding the Pfizer vaccine. The short answer is the Pfizer doses are almost universally delivered through the New York State vaccine sites. And so I will be very candid with you. County governments have been getting the Moderna doses and the Johnson & Johnson doses. And as I said, the state has increased at our request, and we've been partnering very successfully, have increased our Johnson & Johnson doses. But if you're looking for a Pfizer dose, and in particular, I know that those for 16 and 17-year-olds, you might be looking for that Pfizer dose. I encourage you to take advantage of availability at the state vaccine sites. And there are several local New York State vaccine locations. And you can find those at dutchessny.gov. And I do want to encourage you. So if you go to dutchessny.gov, you click on the vaccine information form tab at the top, scroll down that page. There's the sign up for the vaccine form that exists. But if you go further down that page, you'll see all of the locations that have vaccine availability in Dutchess County. And by scrolling down that page, you'll see those other links to those locations. The state doesn't have a centralized place to schedule, and so you've got to look at these individual locations, and there are plenty in the county that have availability. Now, when you're on that page, you can scroll to the Am I Eligible tab, or the tab that relates to the New York State clinics. And we encourage you, if you're looking for a Pfizer shot, to schedule to do that at one of the state locations. And very locally, there is a New York State vaccine site at SUNY Orange in Orange County, the Ulster County Fairgrounds at Ulster County, SUNY Rockland in Rockland County, and the County Center in Westchester. And so look for those locations. Schedule, if you're looking for a Pfizer shot, they're administering them. Very few Pfizer doses available within any of the counties outside of the vaccine sites established by the state. And so if you're saying to me, well, geez, Orange County is giving out the Pfizer shots. Orange County, like Dutchess, is giving out the same doses. However, there is a New York State vaccine location in Orange County, and they are the ones that are administering the Pfizer doses and others. So, want me to figure this out? Okay, great question, Kate from the Southern Dutchess News. There is a significant discrepancy in positivity data for Dutchess shown by the New York Times. Why? The short answer is that our epidemiologist has and does continue to review the data. Our epidemiologist has taken a look at the New York Times article, and we do not know how they're calculating their positivity rate because it doesn't match the state-reported positivity rate, and we go by the New York State reported positivity rate. So the short answer is we don't know how the New York Times concludes their data, but I can only tell you that the New York State data is what we produce and we provide to the public. We'll try to find out what calculation or methodology the New York Times uses, but it's not the New York State Health Department data, and it's therefore not something that we're going to share. But I will tell you again, and we've talked about this, keep in mind, Kate and anyone else, the positivity rate is a very imperfect number. And why is that? Because it really is only the positive cases, right? So the cases that are positive on that particular day divided by the number of tests conducted on that given day. And in fairness, those two things never match. You might take a test today, and me and my wife might get a test today. I might get my positive or negative tomorrow. She might get it 3 days from now. My positive or negative gets calculated in tomorrow's data. And so when the test comes back is really when the numerator of the division, right? It's the top number. The bottom number is the total number of tests on that given day. Those two things don't have anything to do with each other. They just don't. It is a good number to reference. It gives us some long-term sort of measuring tape, if you will, and that's why we look at the 7-day rolling average as a good number, because again, test results come in at sporadic times. The number of tests can fluctuate on any given day. Gosh, if one day the test numbers drop, but the positive cases don't increase, the positivity rate could jump, and vice versa. So you look at what that rate has been over the course of several days, average it out, and that gives you some guesstimate on where you are. But short answer is we don't know how the New York Times has come to their number, but that's the number. Rick, why isn't there a New York state site in Dutchess County? Because the state of New York hasn't opened one in Dutchess County, not for lack of our asking, but what I will tell you, do we have the vaccine? We don't have the vaccine percentages. I like that chart, so let's make sure we do that chart weekly. I will tell you that the state the state opened basically one vaccine site in every one of the 10 New York State regions. And our first and only, up until only 3 weeks ago, was the county center in Westchester. That was our regional site. As vaccination was ongoing, the state looked at locations that were either were at, above, or below the state average. And I will tell you up front, and my friend Steve Newhouse would acknowledge this. Orange County, Rockland County, Sullivan County were significantly below the state average in vaccinations. So the next logical step for the state to open these vaccine sites with the numbers of doses they have was Rockland and Orange. Sullivan still doesn't have one, but Rockland and Orange, and then they chose Ulster, and I think Ulster opened a week ago or 10 days ago. And I will tell you the relationship we have with Ulster. They're accommodating Dutchess residents. I mean, you can get to any one of those locations. We have been exactly at the average, and so. There are a lot of reasons that I could assign to why there isn't one yet in Dutchess County, but I will tell you the vaccine numbers are increasing. The only thing I care about is how many vaccines are getting in the arms of Dutchess County residents with some degree of accessibility. And what I can tell you is based on the numbers, we are seeing an increase in allocation, we're seeing an increase in vaccination, and we are keeping pace with the state average. That does have something to do with proximity, right? For some people, right, I can drive to Kingston or Ulster pretty easily, but that allows us to focus our resources into locations and areas that might not have easier access. So we want one. We've said so. Our state legislative delegation has argued this point. I do think every county in the state needs to have one, especially if you have a decent enough population. The state has not chosen to open one yet in Dutchess County, but perhaps they will. I'll go through the vaccination rates, and this is actually, I think this speaks to that point very, very well. So Dutchess County is at 36.1% first vaccine. So 36% of our residents have received their first vaccine. Putnam County is 37%. Rockland County is 32%, but before that they were lower. Ulster is at 39%. Orange County is 28%. Greene County is 34%, and Sullivan is 29%. And so those counties that have been below in vaccination, I can tell you based on what we see every day when we meet with the state officials, the state's trying to get those numbers up in locations that have had lower vaccine and vaccination percentages, and that's where we are. If you have an additional question, write it down in the comment section below. I do want to remind you again, the Chemical Dependency Form is scheduled for tomorrow evening, and you can visit duchessny.gov/forum comments, and we're happy to get you scheduled. As always, we're very grateful to our American Sign Language interpreters. Very grateful to both of you, all of you who have participated these last 14 months. And April, if you don't know it, is, among other things, is also Volunteer Month. So April is National Volunteer Month, and I want to thank first all of the volunteers. So whether you volunteer in a fire department or emergency response agency here in Dutchess County, or volunteer at a library, or a domestic violence organization, or some charity of your choosing, church or synagogue or faith-based organization, we are tremendously grateful to you. I can tell you, I have traveled to every county in the state. I deal with every county leader in the state. Dutchess County is very unique in that we still have this sense of community that, frankly, rises to the occasion. It's because, in many ways, folks like you are volunteering. I also, however, want to especially thank the volunteers who have participated in our public health response these last 14 months. The Medical Reserve Corps in particular, tremendous volunteers. And these are folks, and you might be interested, you can sign up. These are folks that may have had some medical background, some healthcare background. Many of them have not. Volunteering in a number of capacities at our clinics, at our test sites. They were delivering meals, and just very, very grateful. And while he's not a volunteer, I know he volunteers lots of time. Joe Ryan does a great job coordinating the Medical Reserve Corps, and we're very, very grateful to all of you for doing that. On the others, I want to say, only because it has been a year for me, I want to say, extend to all those families who have suffered loss. You are still and always in our prayers. My son Eli ends most of his nights by praying to God that the germs would go away. And he knows why. Some of that has to do with getting back to playing with friends and seeing family. He would like to see his cousins. Some of that has to do with going back to sort of normalcy in school. Even at 4, he knows what that is, right? What he's missing out on. But he also says it because he knows families like ours have lost loved ones, and still have not yet been able to grasp and settle with that loss. Some lost loved ones in nursing homes and in congregate care settings, and I am tremendously heartbroken for those of you who had to suffer so very long without the information being gotten to you, and with loved ones being isolated. I will tell you that I feel very confident in the healthcare professionals in this community who really worked hard to try to create connection where isolation was. And I also want to extend our thoughts and prayers to those families who have to live with loss. It was a year ago this coming weekend that I lost my father to this virus. I certainly understand the human toll. He struggled with the virus at a hospital in Westchester. Very grateful to the folks at Westchester Medical Center, the nursing staff there who cared for him and interacted with me and my sisters to communicate with my father. And I just say it because no matter where we are in this long journey back to normalcy and through the tunnel to daylight, there are still so many people who have had to endure so much, closing a business, losing and dashed dreams, high school graduations that didn't happen, sporting events that didn't occur, teams we couldn't root for. You run certainly the spectrum of time and memories lost, but lives lost. There's still families that haven't been able to see their loved ones, still families that haven't been able to put closure to that loss, and there are families who have yet to lay to rest or to seek together in some service, some peace in experiencing that loss. And to all of you, on behalf of the people of Dutchess County, I extend my thoughts and prayers, and that's how we'll end today. Our appreciation to all of those who have worked with and cared for other people who've reached out to families and friends and neighbors who need help, to all of us who have, all of you who have risen to the occasion. It's been a struggle for everybody, and I will tell you that my own personal loss is not greater than the challenges that residents have faced, and I put you first. We pray for you, we hope for you, and we're grateful to you. So with that, stay healthy, be strong, and be kind to each other.